Hello, I'm Elyse Lower from the University of Cincinnati, and it's my pleasure on behalf of Total Health Conferencing to review with you 4 abstracts from the recent ASCO 2021 meeting on metastatic breast cancer. CDK inhibitors are important mainstays of treatment for our patients with advanced disease. And the Donna study looked at a potentially new CDK inhibitor, dalpiciclib plus fulvestrant, versus placebo plus fulvestrant for our patients. And it suggested that, like the other FDA CDK inhibitors, that this was a well-tolerated regimen, and it also showed similar efficacy. There was, however, an increase in grade 4 neutropenia with this potentially new CDK inhibitor. Because CDK inhibitors are often our mainstay of therapy in patients with ER-positive disease, we know that eventually resistance will develop. And BCL2 blockade is a potential way to overcome that resistance or delay it. The Veronica study analyzed BCL2 inhibition in our patients. Unfortunately, this study failed to meet its primary or secondary endpoints of progression-free or other overall survival. However, it's important to realize it was studied in only those patients who had CDK inhibitor therapy in the past, and perhaps another patient group might benefit. One of the questions that our patients with ER-positive, HER2-positive metastatic breast cancer often ask us, and we even ask ourselves, is does chemotherapy need to be added to Herceptin or an anti-HER2 new therapy, or can patients get by with hormone therapy along with anti-HER2 new treatment? And this abstract randomized patients to receive chemotherapy plus trastuzumab versus hormone therapy plus trastuzumab. And the hormone arm was non-inferior to the chemotherapy arm, suggesting that there are a group of patients for which hormone therapy and trastuzumab alone might be beneficial. Keep in mind, the abstract suggested that those patients with a shortened disease-free interval of less than or equal to 24 months might still benefit from chemotherapy. And finally, 1,200 metastatic breast cancer patients are telling us that they are quite concerned about side effects and the initial doses that we are looking. And there's an important survey of those patients suggesting that more dialogue is necessary for our metastatic breast cancer patients when we think about dosing and how to avoid side effects. Thank you, and I hope you'll enjoy the abstract presentations.